we are going again to talk about high blood pressure, but focusing on signs and symptoms. High blood pressure, unfortunately, may not show in the patient suffering from it symptoms that the client or the patient can complain of. They will continue to feel normal, yet the blood pressure is continuing to increase from the normal range, which we talked about, 139 systolic out of 89 diastolic, and below. That's where we're expecting our blood pressure to be. But it can increase beyond that without causing the person to feel any symptom or to have a cause to seek medical attention. This is so dangerous that a person can die because of high blood pressure before they are actually diagnosed. Before they know they have it, it can kill them. It can kill you. The very reason why we need to pay attention. At times, some people could feel some headaches, vision disturbances, which we call blurring of vision. We can see people complaining of some chest pain, and others can tell that their heart is beating sometimes rapidly, and they find it difficult to maybe climb a hill, climb steps, get upstairs. Those might be indications that there might be high blood pressure. Before it is diagnosed, a person can get damage to the kidneys, damage to the heart, damage to other important body organs. The only way, therefore, to tell whether you have high blood pressure or not is to measure it. Otherwise, for people to start feeling symptoms that can draw them to getting health care services is when the blood pressure has gone usually to around 180 out of 120, which is very high blood pressure. That's when they talk about severe headaches. They have a headache, they cannot be able to control, they've taken common painkillers and they cannot get relieved. So they get concerned, and this could be high blood pressure. They can talk about pain in the chest, which might follow activity, and they can also talk about dizziness. They feel like they are swinging, they are most likely falling. Others start experiencing difficulty in breathing. They can't breathe well. Others can develop feeling like vomiting, while others can vomit. They don't have fever, they are not feeling cold, they are not having joint pains, but they are vomiting. And the vision failure to see well can happen, which can be a complaint. Or they are no longer seeing the way they used to see, or they are seeing certain things altered. While others can get to points like getting confused, a bit of confusion, and others might feel like they are anxious, as if something bad seems to be happening or about to happen. All the time they are uneasy. Sweating, they can talk about sweating. Sometimes they feel like they are sweating all over. And those are indicators that something might not be going right. Very important, therefore, to note that should you be feeling such, get concerned, seek help. Other people can actually start experiencing, feeling like something is ringing in their ears, while others may end up bleeding from the nose. We call it epistaxis. However, others might tell that their heart runs rapidly sometimes, then slows down, rapidly slows down, and they are aware of their heartbeat. Under normal circumstances, people are not aware that the heart is beating. The heart will do its work without you necessarily knowing or seeing that it is actually, feeling like the heart is actually working. Those are some of the symptoms that can get people concerned, and we can suspect it is hypertension. Now, I told you that the way to diagnose it is to go for a test. Once you go for blood pressure measurement, the health worker will be able to determine whether your blood pressure is higher than the normal, expected normal range, which should be a systolic of not more than 139 and a diastolic pressure of not more than 89 millimeters of mercury.